Yes, ma'am.
Okay, so we will discuss now what are the various factors affecting wound healing. Actually, if you see related to this, there are so many factors in combined. Okay, starting from the way we eat. Okay, the way or if we have any other particular disease, then our lifestyle or age, then any type of medication. Okay, and even on the extent of the wound. Suppose if the wound is very large, so obviously, even if I think if you remember, I have discussed even in a previous class that the larger the wound, so the healing process also will take more time as compared to the wound which is smaller. Okay, so we will see with the various factors one by one. So the first factors which affect wound healing is age. Okay, so in age what happened, it is said that people are in their younger adult, like younger children, suppose, then younger adult as compared to older adults. When we say older adults, that means those people are above 60, 65, or those are in their 60s above. So in those, when you compare these two individuals, it has been seen that the healing process, it is very faster in compared, like in the younger adult as compared to the older adults. So as what is the main reason behind is that because, as you know, as the people get older, the skin elasticity also becomes very loose. That means that's why that is the main reason why people develop wrinkle, yes or no, when they grow older, because the skin, it is elasticity is being lost. Okay, and not only that, the second more important thing is that whenever people become old, what happened, because of maybe some health condition, especially diabetes mellitus, this or any cardiovascular disease. When we say cardiovascular, it means related to the heart, if they have any problem. So because of that, what happened, there will be disruption in the blood flow or the blood supply. So in that condition also, the healing also may take time. And not only that, if the people is already in the very old, in the old state, what happened, even the production of collagen also might be disrupted. Okay, if you remember, this collagen is a very important element which is being released by the fibroblast cells. So these collagen, they act as a this one structural framework for any wound to heal, or for any, like if you remember, whenever there is any wound, there is always a gap. So in order to fill that gap, so we need some form of collagen. So in this cases also, when the people grow older, so the production of collagen is also being disrupted. So these are some of the main factors which may occur, for the wound to heal uh, very slow in the older adult as compared to the young generation. So as you know, when people are still very young, everything still they are able, like skin elasticity is good. Okay, they have a very good immunity also, if you can say. Then the healing power also, it becomes very faster, because when we are in a younger age. The second important factors is the diet. Okay, so that's why whatever, especially whenever a person have undergone any form of surgery, or if they have any form of wound, we always advise for all this protein rich diet. Okay, because protein is very important element. As you know, protein, we also call it as a bodybuilding food. Okay, so in order for our wound to regain back its strength, to regain back its elasticity, or to regain back its normal functioning, so we need a lot of protein. Okay, so we should always encourage a person, that's why we always encourage a very high protein diet whenever any person have undergone any form of surgery or any form of injury. So with the increase in protein, it will also help in healing of the wound faster. Okay, so not only that, even vitamin A, vitamin C, so all this also helps in quickening the wound healing process. Okay, so the next thing is the lifestyle. Okay, so like regular exercises, I think you all have heard of this. Every time we always say that exercises is very important, because once we exercise, what happen, there will be increase in the blood circulation, increase in the blood flow. So those things are very important for wound healing. Okay, and also, suppose if person have some bad habit or bad lifestyle of just staying sedentary without any exercises, what happen in those people, they don't have a very good blood flow. And if they have the habit of smoking, again, that is also one very bad lifestyle. Some people might have that. So smoking also, what happen, it causes disruption in the blood flow. So whenever we say disruption in the blood flow, means there will be also reduction in the oxygenation. Okay, so and oxygenation is very important for wound healing. Okay, so regular exercise help in quickening healing by increasing the blood circulation. Okay, and then the next point is called as a medication. Okay, so there are certain medications like anti-inflammatory drugs. Okay, some example is like steroids. Okay, uh, steroids in general we call always call it as the anti-inflammatory drugs. Okay, this helps in reducing the inflammation. So even these drugs also actually what happens sometimes they interfere with the wound healing. Okay, so suppose if the person is having any form of wound injury and all, so we try to avoid giving them this anti-inflammatory drugs. Okay, so the next is the infection. Okay, so whenever any wound, if we have any wound in the body, the main thing which we always need to do is to make sure that the wound it is being cleaned properly. Okay, following all the aseptic techniques, because once the wound becomes infected, it becomes very difficult for it to heal back. Okay, am I audible?
Yes, ma'am.
Okay, so
Yes, ma'am.
infection also actually is one of the main factor which might cause reduction in your wound healing. Okay, so that's why whenever a person have any wound, we always used to say, right, they should come do regular dressing. Changing of the dressing is very important because, and we make sure that the wound it is being like we have to maintain really the cleanliness. Otherwise, if you don't do all those, what happen? The wound it will take it takes time to heal. Instead, suppose instead of healing in 1 week, it might take 2 weeks or even months because of infection. Okay, so any form of infection it may be, so it always slows down the healing process. So next is smoking, which I have also mentioned previously. Okay, so smoking also what happened, there will be reduction in hemoglobin. Please mute your microphone. Okay, so smoking also what happened, it reduces the hemoglobin level. Okay, so from where do we get that? It is mainly from the uh, because whenever a person smoke, there will also be reduction in the blood flow. Okay, so whenever there is reduction in the blood flow, there will also be reduction in the hemoglobin as well as reduction in the oxygen. So when that happen, so it will interfere with the wound healing. Okay, so next thing is the immunodeficiency. Okay, so whenever you heard the word immunodeficiency, means people those in which because of some health condition maybe the immunity becomes very low. Okay, for example, a person having HIV/AIDS. So HIV/AIDS, what happened, people having AIDS, the immunity is becoming very that's why we call it as immunodeficiency virus, because whenever a person develop this disease, the immunity totally goes down. So obviously in those type of people, when the immunity goes down, so it also affects the healing. In what way? Because in like there might be high chance that the person might get, okay, even if you don't with slight this management of that wound, they might get any form of infection. So obviously in that way also it will.
Ma'am. Hello,
Yes.
ma'am.
Voice is
Yes, voice is cracking.
Ma'am, it is
Yes,
cracking.
now it's clear. I'm having some
No,
network
ma'am.
problem. Is it clear now? Am I audible now? Is it clear?
Yes, ma'am.
Okay, I don't know today. Some network, my network is not good. Is it visible the slides?
Yes, ma'am.
Okay, so like I've said, immunodeficiency disorder also in those people where the immunity becomes very low. Okay, for example, a person who is with HIV/AIDS, or not only that, a person developing cancer or any form of infection, any form of disease if they have in their body, which reduces the immune system. So in that condition, also what happened, the people might be easily prone to any form of infection. Okay, so that's why the healing it takes time. And vascular diseases means, for example, as we all know that whenever people age, okay, so they are at risk for developing so many form of this vascular diseases, be it their cardiovascular disease, suppose coronary heart disease, okay, or they might have cardiac this one attack or heart attack. Okay, they might have this diabetes. Diabetes also is very common condition which is seen whenever a person's becomes okay old. So what happened, it has been seen that whenever persons have this diabetes mellitus, so it usually affects the blood process or the blood circulation. Okay, so that is, and when once the blood circulation becomes very but once it becomes disrupted, what happened, there will also be reduction in the oxygenation. Okay, so that is the main reason. If you but that's why whenever any diabetic patient is there, okay, we always advise them to do a very good foot care, because what happened, whenever a person develop diabetes because of the health condition, usually the area in the feet, okay, there will be a very lack of blood oxygenation, as we can say, and because of that, usually the area becomes very numb. So even if they got, if suppose if they got hurt, or if they cut themselves also while walking, suppose if they walk barefoot, so in that condition also what happened, they will not even realize it because of the numbness. So actually numbness, what happened, why it happened, because of the reduction in the blood circulation. So that's why whenever we have any patient with diabetes, okay, we always concentrate on foot care. This is very important. Okay, so like how they every day they have to see their foot, okay, daily, clean it daily. Okay, then not to wear, not to walk barefoot, because even if they have a very slight injury, it takes a very longer period for the people with diabetes. The wound healing, it takes longer time because of the reduction in the blood supply. Okay, that means reduction in oxygenation. Okay, so this also, it affects actually the wound healing. Okay, so the next is the extent of wound. Okay, so the deeper the wound, okay, or the larger the wound, so the healing also will takes time. Okay, so deep wounds with more in tissue loss, it will leads to a very slow healing process, because especially in those wounds where it is very large, so obviously the healing will take longer time, because the area is already very large enough, so it will take time to fill up that gap. Okay, and obviously if again, if proper care is not being taken, okay, again it, because, and suppose if any infection again it occurs, then again it will take more and more longer time to heal. Okay, and oxygenation too, I think, even in all those previous slides also repeatedly I have been mentioning about the importance of oxygenation for wound healing. Okay, so reduce oxygenation to the wound, what happened, it inhibits the repairment. Okay, so a wound heals slowly when local blood flow is reduced. Okay, so oxygenation is very important for the healing process to occur. Okay, so, and next is the low hemoglobin level. Okay, so anemia, I think you all know. Okay, whenever a person develops anemia, what happened, there will be reduction in the hemoglobin count. Okay, so what happened, whenever there is reduction in the hemoglobin count also, there will also be reduction of oxygenation as well. Okay, so as you know, if there is reduction in the oxygenation, so there will also be reduction in the repairment. Okay, or slow in the wound repairment. So these are actually some of the main factors which affects wound healing. Okay, starting from the age, then starting from the diet. Okay, then the this one, vascular disease. Okay, starting from the hemoglobin level, immunization, lifestyles. Okay, then extent of wound. So immunodeficiency conditions, so infection, smoking. So all these are some of the very important factors which might affect wound healing. Okay, so next we will see with the complications. So obviously if proper care are not being taken, so many complications can occur, okay, whenever we have any form of wound. So the first one is hemorrhage. Okay, so whenever you hear the word hemorrhage, it means nothing but bleeding. So what, how can bleeding occur? Sometimes what happen, even under this intentional wound, suppose even after a surgical incision, so sometime what happen in those time, if proper care is not being provided, or if the incision, it is not being done properly, so there is a chance that there might be tearing of the suture or tearing of that thread. Okay, so in that condition also what happened, there will also
Ma'am,
be
again,
bleeding. Okay,
working.
so it may be caused by a dislodged clot. Okay, dislodged clot means like what happened, if you don't, if you I think all of you also must have experience whenever we have any wound or cut, so immediately in order to control that bleeding, there is a clot formation, or like a cap
Ma'am,
type which
again, your
forms
voice is
in the
working.
wound healing area. Okay, so if that also came out, then in that condition also what happened, this one hemorrhage or bleeding can occur. Okay, or a slip suture. Whenever we say suture, many of these are the stitching, okay, which is done on the wound. So in some condition also, sometime what happens, suppose if it is not being in nice, if it is not properly done. So suppose when a person suddenly sneeze, okay, so in that condition also there will be hemorrhage or bleeding. Okay, so the next is the fistula. Okay, so whenever we say fistula, means it is an abnormal passage between two organs or between an organ and outside of the body. Okay, so abnormal, when we say passage, is like a tube formation. Okay, so sometimes there, whenever because of the increase in the inflammation or because of the infection, so some abnormal passage will be formed in order to release the pus formation, because whenever there is any wound there will be formation of some pus and all. So because of that also this fistula might develop. Okay, then infection also might occur, then delay in the wound closure. Then other than that, okay, so then again this dehiscence. Okay, whenever we say dehiscence, what happened? So whenever the wound healing is delayed, the layer of tissue may separate. Okay, as you can see from the figure, which is caused by sudden strain such as coughing and sneezing. Okay, so that's why whenever a person, whenever a person have any form of wound, we always advise the person when to cough, whenever they cough, in order to, like, they should hold that suturing area. Okay, so by doing that, in order to prevent this form of this one dehiscence, or where the wound or the thread it came out. Okay, then the last one is the evisceration. Okay, so evisceration means, as you can see, that sometime what happened from the wound there might be some protrusion. Whenever say protrusion means coming out, okay, of any visceral organ, means internal organ. Okay, through the wound opening. It may also lead to total separation of the wound layers, as well as it might need some emergency repairs. Okay, so these are some of the main complications of wound healing.